Hello and good evening. My name is Kanulia Menakaya, and this is my Texas State Nursing School interview for the Round Rock, Texas. For my first question, the experience that motivated me to want to become a nurse to help a diverse community of patients was caring for my mother. I am my mother's oldest living child. However, my older brother passed before I was born due to health complications from poor care in Nigeria. My family is originally from Nigeria. However, they immigrated to the United States due to a variety of reasons, one including the lack of healthcare and representation in Nigeria that I will later discuss in my interview. When my brother passed, my mother was very depressed, emotional from the loss of her child. But thankfully, by the grace of God, I came into my mother's life as her rainbow baby. And I feel like that connection later led to my uttermost care to nurture and protect her as she did for me. As I grew up in America, seventh grade, my mother's sister, my aunt, was diagnosed with diabetes, and this diabetes later led to kidney disease, which eventually led to her death. The following year, my grandfather also passed. My mother's father passed from health complications in Nigeria as well. Both of these deaths within a very short time frame took a very massive toll on my mother's health for herself, and as her oldest child, my obligation was to take care of her and was to make sure that she was okay, was to condition her back to health, was to make her feel healthy again, be healthy again. Because although my aunt and my grandfather weren't present on earth no more, I couldn't lose her. So that experience taught me the importance of nurture and care, and conditioned me to want to do that for others, because the lack of representation for people's loved ones within nursing homes and facilities where healthcare providers are entrusted to take care of patients, some involved in malpractice. So I want to condition to show that there are to be part of the good community of healthcare providers. For the second question, I chose the Texas State Nursing Program because I believe that this is the only program that can condition me to my fullest extent of success. Statistically shown, Texas State Nursing Program for the past several years has had a 100% pass rate on the NCLEX for all their nursing students. I believe that this is not by coincidence. This is because Texas State is designed to engineer their students to their fullest capability and capacity to make sure that they are successful. And I would be grateful to be a part of a program that can get me there. Additionally, how I have prepared for the Texas State Nursing Program is I made sure that I am a student worthy to be in a conditioned program. Because of how successful it is also rigorous to get there as well. So I have worked endlessly to maintain the proper education that I need to get there, actively involved in school, organizations, and getting healthcare experience as well. This healthcare experience includes volunteering at the Student Health Center at Texas State, learning how to obtain vital signs, learning how to properly perform aseptic technique, learning how to perform patient care, learning how to protect patient information. Third, for the third question, how my personal strengths will contribute to my success in nursing school and my career in nursing is I have a variety of experiences that I've been gratefully blessed with, involving being a a laboratory instructional assistant, in which we are actively working with bacteria and learning how harmful pathogens are and diseases are, and how to take proper technique to avoid, to the best of their ability, these diseases, which I believe is essential for healthcare. Community service wise, as stated previously, I volunteer at the Student Health Center, and I worked actively with patients, communicating with patients, patient cares, cleaning up patient rooms, and protecting patient health information. Additionally, I'm also on the executive board of a woman student female led community service based organization in which we actively volunteer at nursing homes, learning how to talk with patients in certain care, and even small community service like cleanups and things like that. Work experience wise, I am a pharmacy technician trainee. I work at a nearby pharmacy on top of that, in which I actually took the job to preparing myself better for nursing school for the pharmacology course. I've heard it's challenging, and I wanted to take every precaution to make sure I was prepared for nursing school because I know that this is for me, and I did everything conditioned to get myself there. Four, if I was in a situation as I'm driving up I-35, 7:30 a.m. for a major exam, my tire goes flat, check engine on, and my gas gauge is empty, my first response is to actively and safely get myself to a location without being a danger to my community. Whether that is parking on the side of the highway and then walking to a safe location, or and then getting to a safe location, I would then call somebody, a friend, a Uber to pick me up and to go, then continue to go take my exam. Because I'm a critical thinker, and in my eyes, I cannot move the time of the exam. I cannot adjust the time. I can't provide an excuse or excuses for the exam, but I can attend to that car after the exam. So about priorities and working quickly. My first priority is to not be a danger to my community and not to put other people's health and safety at risk. As I'm attempting to be a healthcare provider, I should be cautious on the road so I don't endanger the lives of other people. Wrecks could getting in a wreck or acting dangerously could potentially harm the lives of others. If I'm trying to be a nurse, that just is hypocritical to my standard. Lastly, attending nursing school is a full time commitment, and how I plan to meet these rigorous programs and requirements while managing my time and responsibilities is by actively keeping myself organized and structured. For the past 15 months, I have worked diligently to become a structured individual, an organized individual, because this lifestyle has been the best to keep me on top of school and on top of my busy schedule with working, volunteering, and trying to maintain adequate time for studying and just being a young woman. I keep an online planner that actively plans my days. I plan on taking this standard and these morals with me along in nursing school as well, planning this in nursing school as well, because it's going to get extremely rigorous and I am 110% ready for every part of it. As I'm currently an organized person, I continue to maintain this following me to nursing school, and I'm ready for the challenge. I feel as though my experiences and my um, leadership has contributed to prepare me to be uh, in nursing school. And I would just like to say thank you for giving me this experience to have an interview and to showcase myself and my potential. I hope you guys have a wonderful evening. Thank you.